It is indeed a healthy Thursday. We have great health conversations here on our show. Month of October is a pink October. We've been talking about breast cancer. Last week, Thursday, the concentration was on men. And today we're bringing it all together. If you've missed any of the breast cancer conversations, don't worry, because Dr. Samson Asala, who is general practitioner, Medifem multi-specialist hospital and fertility center, is here to help us go through it all over again. So good morning, Doc, again this week. Thanks for making time.
Thank you for having me.
Yeah. Did men show up for the screening, or have men shown up after last Thursday's conversation? Have you seen more men?
Yes, I have. And actually, some people have reached out, men who had issues with their breast, they had breast enlargement, and they were wondering what it was. So the word did go out. So people are going to the clinic to have their breast checked. The men. Some women also reached out, but then the men did. And that I think that was really good. Okay. That was really good.
All right. We even need some more men to show up because there's free screening.
Yes.
Pretty much in a lot of centers.
Yes. There are so many hospitals in this month of October that are offering free clinical breast examinations. At Medifem, for example, we do it every Monday and Friday.
Okay, so
from 9 to 3. So tomorrow, anybody can come in and have their breast examined for free.
Okay. All right, so let's go over what we want people to pay attention to in this month of October as we talk about breast cancer. So where are you going to start from?
Right, so I want to start with a story. So I have, this year, I've had 2 friends whose mothers have passed away from breast cancer. For one of them, very close, whose mother discovered changes in the breast last year, and she saw it, thought it was the change in the breast, didn't mind it. It was the daughter who saw it and prompted her that, "Mommy, what is happening here? You should have it checked out." Mommy was like, "No, she doesn't want to do anything about it. She'll just pray." And they kept talking to her. So I was called in to speak to her, and I told her that, "Oh, Mommy, the way it is, let's just go and have it checked. Let's just have it checked." There was some reluctance, but eventually she went to the clinic. At the time she went to the clinic, the cancer had spread.
Oh.
The cancer had spread to a point where she needed chemotherapy, she needed radiation, and for some time it seemed like we were winning. There was a sore that developed, cancers can do that, a sore developed, and later on we had to do surgery. So at some point in time, we felt like we were winning because she was much better. She was more active. We did not see the lesion, and we thought that we had won. But a few weeks to months later, we saw that a sore started forming where the cut was. So there's no breast there, just a scar. But then the sore started forming. So that tells us that we couldn't get everything.
Oh.
We couldn't get everything, and that is the sad part. You know, breast cancer affects women especially in their 50s and their 60s, older women. And what happens then is that, you know, mothers give a lot for their children. Mothers at that age are more concerned about their children's health than theirs. And so it is sad because I have felt it. I see a mother who has toiled and is at a point where she's about to realize all the fruit of her labor. Her children are about to get married, give birth. She's about to see her grandchildren. You see all the excitement there as a young woman when your mother is there to help you take care of your child. And then this thing happens.
Yeah.
And it takes a toll. Apart from the financial toll, even emotionally, it becomes very difficult because you see your mother going through this. You worry about how she is going to. And you know that it's not going to be possible going forward for your mother to be there to take care of your child. And that's the part of it that is worrying for me. Because mothers in their 50s, in their 60s, it is time for them to reap what they have sown into their children. You see, and children is a time that you need your mother's support in a time, you are now starting your family. It's so important that, your mother is around, the children have their grandmother and all that. So when this thing starts, it is so devastating.
Yeah.
It is so devastating. And that is why we keep talking about it. And that is why every year we will continue, because till every mother starts doing the screening, starts doing annual or biennial, that means every year or every 2 years, doing a mammogram, having the breast checked, we will have these stories. And when it hits close to home, you feel it. And it's always sad when you wonder, so I could have done something about it. I mean, I heard the conversation earlier about stroke, and the doctors told you that stroke, you can do something about it. When it comes to the point where you look back and you're like, if I had known, that is the sad part.
Yeah.
That is the sad part. If I had known. And so even though we are telling mothers out there, women out there to do the breast exam, I want to talk especially to children,
Okay.
Those who are in their 20s, even their teenage years. Tell your mother, at this point, they may be busy going around trying to do things to make you happy, but sit them down and tell them, Mommy, I heard on the news that this thing is important. I don't want something happening to you. Please get your breast checked. Please go and do the screening. Because otherwise, Mommy is busy. She's going to the market. She's going to the shop. She's going to work. She's doing everything to make you comfortable. But if we find it out today and we do something today, we can save it, and then in the end there'll be smiles instead of tears.
Yeah.
Yes.
So the mammogram is done twice a year, you said?
No, so mammogram is done either once a year or once every 2 years.
Okay.
So usually it starts every year, then after some time we increase it to every 2 years. The guidelines differ. Now there are so many medical organizations that have come together to try and see how best can we identify breast cancer early and what can we do. So they use evidence to say that, okay, let's do this every year or every 2 years. So some will say that do it every year, and others will say do it every 2 years.
Okay.
And then for some, you start every year and then you transition to every 2 years.
Okay.
But the mammogram should be started from about, definitely by 50, you should be doing mammogram. But some have it earlier by your 45. So personally, what I recommend is that just like we tell all men that from the age of 40, you should make sure you check your prostate, do prostate test, and then do the examination. Then the same for women. From 40, you should make sure that you do your annual clinical breast exam, and then you do your mammogram, so that we pick it up early. What's
the difference between the breast examination and the mammogram?
All right. So anybody at home can take a rule and try and see what a millimeter is. A millimeter is a very tiny size. A millimeter is so small. Now, with the clinical breast exam, there are limits to how much we can feel. Okay? When a breast cancer starts, the last time we said it's abnormal growth of cells. The cell is very, 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 very tiny, microscopic. So by the time it gets to even a centimeter, it means that there's so many billions of cells, right? Now, when the cell starts as 1, when it is less than a millimeter, we can pick it up with a mammogram. So mammogram detects it earlier than we can feel.
Okay.
In fact, you can pick early breast cancer on a mammogram up to even a year before we start feeling it. Now, we are saying that the earlier we detect it, the easier it is to treat, and then the less the complications. It means that if we do mammogram, then we can pick it up so much earlier that it will be like just a small procedure, nothing major, and we'll not have the instances where we think that we have one and then later on, it had actually spread. Okay.
Yeah. Is this a painful procedure?
No, it's not. It's not. So the mammogram is a type of X-ray. Now, because the breast tissue has no bone in it, the kind of radiation used in a mammogram is very, very limited. X-rays use something called radiation so that we can see through the structures. You know, you cannot see, as I'm looking at my hand, I can't see the bone. But radiation goes through it, right? Now, with things like bone, you need a certain level of that radiation. But with the breast, there's no bone, so you reduce it to the barest minimum.
Okay.
So that we can see small signs of the cancer starting up. So it is just like you go and have X-ray, they put something on your chest or your leg. So in the same way, they do it on your breast. So they'll put your breast in a particular X-ray conformation so that we can see if there's any sign that something is starting up.
Okay.
It is not painful. It may be a bit uncomfortable. Obviously, you are naked and they are put on the breast. It's uncomfortable, but then the benefits far outweigh the discomfort that we'll feel.
Okay. Let's also talk about care when you have breast cancer. How do you care for yourself? Okay.
So if we are unfortunate and we do not pick it up early, and we get to a point where it is detected and we need to do something about it, there are so many things that go into care. There's a medical aspect, and then there is care that is provided psychologically. Okay. Now, the medical aspects, we've mentioned some of them. We talked about the testing that is done, because once we feel a lump or we see something, we go ahead to do some testing to define the particular tissue, the particular type, to know what kind of treatment it is. Then we start treatment. So surgery, chemotherapy, radiation. Now, all these treatments by themselves can cause problems. The last time I mentioned that cancers are rapidly dividing cells. And in the normal human being too, we have rapidly dividing cells. Some of these rapidly dividing cells are your red blood cells, the one that takes oxygen around your body and all those things. So if you are given chemo, for example, then it means that even as it is targeting the bad cancer cells, there is the collateral damage on your good red blood cells. And when your red blood cells are down, you get anemia. Anemia means that you'll be tired, you'll not be able to do the things that you normally do. So you see that somebody who is on chemo is not able to do the work that she normally does or he normally does. Is not able to, he easily gets tired, walks a little bit, and then the heart is beating fast. Yeah. And then you also are at risk of infections. So in addition to providing these, in a chemotherapy unit or in a breast cancer management unit, we look at these known complications and how we can help. But apart from this is what we'll do in the clinic. Now, in the home, it's important that you realize that this is a condition, this is what it entails, and these are some of the side effects. Because for the majority of people that I have seen in my practice who have breast cancer, they have some level of depression. They have some level of depression. They begin to wonder, hey, what did I do wrong? You know, for those who know that it is something detectable, they begin to blame themselves for not going to detect it early, you know, and then they begin to think, what happens if I go, my children? And so all those concerns give them some depression. So it's important in the household that we know these things. Okay. And try and lift up the mood. Yes, it is a diagnosis that needs to worry, but we shouldn't make it a burden. We shouldn't make it a weight on the mother, on the woman or the man who has breast cancer, to try and make the living condition better. And also, if you know this, there are some kind of work around that you will limit it. Okay. I mean, there's no point in letting a mother with breast cancer do all the house chores that she usually would do, because we need to understand and be empathetic, know what the condition entails, and what it means to help out the way that you can.
Okay.
Help out the way that you can.
Okay.
Yes.
So if you're breastfeeding and you discovered a lump, should you discontinue breastfeeding?
Okay, so in breastfeeding women, there are conditions that cause a lumpy feeling. It is something that we know in breastfeeding women. So if you are breastfeeding and you have a lump, it's best that you go to the clinic, because I'm sure some women have had what is called breast engorgement, or in some cases mastitis. They'll feel like there's pain and then there's a lump in their breast, right? If you go to the hospital and say, oh, this is what it is, in that case, breastfeeding actually helps.
Okay.
It helps to dislodge it, and it helps in the treatment of that condition. If you go and we figure out that it is breast cancer, then we'll go through the motions. We'll have to do the testing, try and see what stage we are in and what we need to do. In most cases, we may have to stop breastfeeding.
Okay.
But because of the similarity when it comes to lump in a breastfeeding woman, because it may be the normal caused by accumulation of breast milk in some ducts, as opposed to the cancerous one, it's important we check, because indeed the approaches are different. In one, we'll say go and breastfeed. Yet I would say don't breastfeed. Okay. So we need to check and show which one it is.
Okay. Do men also do the mammogram?
Yes, men can also do the mammogram. It's I must say that personally, I have not seen a man with a mammogram here in Ghana. Okay. Yes, but men also can do the mammogram.
Okay. Yes. Cost for the mammogram, typically.
Right. So the good thing about October is that because of the increased awareness, most places will reduce the cost of doing the mammogram. Outside October, usually it's a bit expensive. It may range about 200 or something cedis. But then for most places, in the month of October, they are reducing the cost of the mammogram. Okay. So this is the best time to take advantage of it. And indeed, every October, I am sure there are some organizations I know that make it a point to reduce it so that they can help detect. Because it's not only about the profit. They have this social advocacy to try and reduce it. So in the month of October, some places have reduced it by 50%. So that would be in a range of 100 cedis for a mammogram. So if you can do it, then this month we have maybe 48 hours or so, but you can have it done so that in this time we can detect.
Okay. Do you need like a special conversation before you go and do it? You know, would they have to prepare you for what you're about to do? Or you just walk in and have it done?
Well, because like I'm saying, in October, you can just walk in, and then once you have a request for a mammogram, you can have it done. I'm sure even some places you can just go and request for the mammogram.
Okay. So I doubt the national insurance will cover that.
As of now, no.
Okay.
As of now, no. It doesn't cover. As far as I know, it doesn't cover.
Okay.
Yes.
So just your final thoughts on this whole breast cancer conversation from your experience as well. What would you leave on the minds of our viewers?
Okay. So the most important thing I think people should know is that if we detect breast cancer early, we can prevent a lot of problems. And detecting it early is easily available. You can do the clinical breast exam every year. We can do the mammogram. They all pick it up early, because I have seen the toll it can have. And it's not something that I wish on anybody. So let's go out, let's do it. All women who are 40 and above, do your detection, your mammogram, your examination. Even below 40, they should still do the clinical breast exam. And then tell the women in your life, your sisters, your mothers, your aunties, everyone who is close, ask them if they have done it. You know, sometimes they're so busy. So ask them if they have done their breast exam and make sure that they do it.
All right.
Yeah.
The last thing we'll leave is the contact number if you want to talk to our doctor or you want to talk to the hospital where he's coming from, which is Medifem Multi-Specialist Hospital and Fertility Center. Dr. Samson Asala, I am very grateful.
Thank you.
Maybe in the future we can talk about other health conditions as well, because usually we are accused that, oh, you spend so much time talking about breast cancer in October and very little time talking about other conditions as well. So we should talk about other conditions in the future.
We would.
Yeah. Thank you so much.
Yeah, thank you.